My name is Vinod Srinivasan. I live in Minnesota in the United States. And today is March 20th, 2025, and this is my fifth visit in the last 2 years to Vancouver to the Wellspring Clinic. I have glaucoma, so I have one eye, and that eye has a large blind spot in the center. So that, progressive. Usually it gets worse and there is no known cure. One can only, according to Western medicine, one can only stop the further progression of the disease by so I've been coming here and seeing progress in terms of the reduction of my blind spot with every visit. As I said, this is my fifth visit. Um, I Yes, if I talk about what progression has been, this representation of my field of view last year. The rectangle is the field of view, and inside it, the shaded area is the part that was the blind spot 1 year ago. And then, for example, I have had, so that was at the start of last year. Since then I've had, so that was last year, 2 visits last year and 1 visit this year. Beginning of the visit this year, the blind spot had already shrunk to this after 2 visits last year. And in the last week or so, the blind spot has shrunk a little more. There are portions on the left diagonal where it's really thinned down, so my overall field of view has dramatically increased and I am a lot more functional. I can signs now that I could not earlier and so on. Nothing, to be honest, because central vision, it turns out, different. My peripheral vision, I always had peripheral vision. I drive right now. Um, the read, which is a big problem in any profession. But in last visit, since the last visit, I can read big font without any glasses and so on. So I get, there are some cases where actually I find that this has already made a difference. When central vision really comes back, I can probably have a completely normal life, and I can see that happening. But in terms of function, I can much more aware of my surroundings um, because of reduction in the size of the blind spot. As I said, I can squint and read street signs that I had no chance of reading earlier, and I read large font. All of this was not possible 6 months ago. So every single session I can see like there is slight change, and slowly it's the size, I compare to the previous day, you can see, but there's no like single when you can say, oh, now it really changed. There's a very clear change in the size of the blind spot after every day. So yeah, I claim to understand Chinese medicine. I don't understand it, right? Because, but is to say that it is not a valid system of knowledge, right? Um, um, I have to. Some things are, in the right hands, can cure things that Western medicine currently does not understand. So the system of meridians and all of that, that's a very different way of description, which someone like me trained in Western systems of thinking may not understand. But obviously I can see that it is working, and I myself have seen that sometimes I have like this in my visual field and he sticks a needle in one particular place and it almost instantly disappears. So it works now. Yeah, and that is for, in my case, vision, and I can see people with skin issues, and those are actually, I know that many acupuncturists can treat chronic pain or backache and so on. And Dr. Yu, of course, specializes in eye issues, which I don't know of anyone else doing so well. But yeah, I don't understand how Chinese medicine works, but I cannot, there is no way of denying that it does not work in the right hands. And so it really depends on the practitioner along with the system of medicine. Yeah, obviously I come here every 6 months because that is maximum frequency that works for me. I cannot come more frequently. And every time I see results when I come here. Now, of course, everyone would like to come as frequently as possible if they agree, if they do see results. but there may be, it's different. Um, have a question of, Han, make sure that in between visits, the does not deteriorate, because it's clearly a bump, during the visit, and then one has to make sure that it stays like that until the next visit. Um, and have now, of course, Dr. Yu and Kathy tell us that exercise and the herbs will help, and that is probably true. I have early in the visits I was not very regular with the herbs, and I am finding that with the herbs I am able to almost that, or maybe even maintain that vision between visits. I am trying to figure out by talking to other patients if there is anything that is, I've observed something similar. Example, there is another patient, Jeff, who I have talked to, and he says he is very regular with exercise, and he thinks that is what has helped him maintain vision. Others, it is the herbs, and maybe it is both. Yeah.